Hi, I'm Garvin. This telecast is on Betnesol-N drops. So what are Betnesol-N drops used for? They're used for the short-term treatment of inflammatory eye conditions when prevention of bacterial infection is also required. It's also used for inflammation of the outer ear when prevention of bacterial infections again is also required, and inflammatory conditions affecting the nose and again when prevention of an infection is required. So how does it work? Betnesol-N eye, ear and nose drops contain two active ingredients, Betamethasone and Neomycin. Betamethasone belongs to a group of medicines known as corticosteroids that are used for reducing inflammation. Neomycin is an antibiotic that is included in these drops to prevent infections with bacteria. Corticosteroids are hormones produced naturally by the adrenal glands that have many important functions, including control of inflammatory responses. Betamethasone is a synthetic corticosteroid that can be administered into the eyes, ears or nose to decrease inflammation in these areas. Inflammation occurs as a result of allergy or irritation and is caused by the release of substances that are important in the immune system. These substances cause blood vessels to widen, resulting in the affected area becoming red, swollen, itchy and painful. Corticosteroids work by acting within cells to decrease the release of these substances in a particular area, thereby reducing swelling, redness and itch. Neomycin belongs to a group of antibiotics called aminoglycosides. These antibiotics have the ability to kill a wide variety of bacteria. Neomycin binds to components in the bacterial cell, which results in the production of abnormal proteins. These proteins are normally necessary for the bacteria's survival. Therefore, the production of abnormal proteins is ultimately fatal to the bacteria. The combination of medicines in Betnesol-N drops is used to treat inflammatory conditions of the eyes, ears or nose that are likely to become infected with bacteria. They're to be used with caution in children, and nasal conditions in people who have recently had nasal surgery, and eye conditions in people with thinning of the cornea or scleria. It's not to be used in fungal or viral infections of the eyes, ears or nose, tuberculosis infection affecting the eye, and eye conditions that are producing pus, and inflammation of the front of the eye or cornea or the membrane lining the eye, conjunctiva, due to the herpes simplex virus. Also glaucoma and ear conditions in people with perforated eardrum, nasal conditions in people with tuberculosis affecting the lungs. And these drops should not be used to treat a red eye that has not been diagnosed by a doctor, as inappropriate use can cause blindness. So this medicine should not be used if you're allergic to one or any of its ingredients. Please inform your doctor or pharmacist if you have previously experienced such an allergy. So pregnancy and breastfeeding. The safety of this medicine for use during pregnancy and breastfeeding has not been established. It is not recommended for use during pregnancy or breastfeeding. Consult your doctor for further advice on this. And the main side effects, the possible side effects when the drops are used in the eyes are local irritation, itching, stinging or burning sensation, temporary blurred vision after putting in the drops into the eyes, ulceration of the front part of the eye or cornea, increase in the pressure inside the eye or glaucoma, which may lead to problems with your sight. If used in the eye frequently or for long periods of time, corticosteroids such as this one can cause partial loss of vision due to cloudiness in the lens of the eye or cataracts, dilated pupils, drooping of the eyelid, inflammation of the outer surface of the eye. So the possible side effects when the drops are used in the nose would be nasal irritation and dryness, sneezing, headache, lightheadedness, itchy rash, nausea, nosebleeds, asthma, perforation or ulceration of the nasal septum, disturbance or to sense of smell or taste, and slowing of growth has been reported in children. So children's height should be monitored if treatment with this medicine is prolonged. So possible side effects when the drops are used in the ear are local irritation, itching, stinging or burning sensation, dermatitis. So for more information about other possible side effects, you can read the information leaflet provided with the Betnesol-N drops or talk to your doctor or pharmacist. So if you have any questions, you can contact me through the live pharmacist on the website. You can email me or call into Lynch's Pharmacy in Cork. Thank you for watching and have a nice day.